This is Pam. Today we're going to be talking about multiple sclerosis and pain because at least half of people that suffer from multiple sclerosis suffer with some type of pain. It could be terrible cramping, spasms, it could be stabbing, sharp pains, burning sensations. And the reason that we're dealing with this pain is that MS is an infectious disease. It is caused by infections, and the inflammation that is present is causing the pain. And that is really a reaction of our immune system that is battling infection. So today I'm going to be talking about what we do, what the wellness champions do to overcome these infections, to recover from inflammation and pain, not to live on pain medication for the rest of our life, but actually to create health. If we haven't met, my name is Pam Bartha, and I'm the author of Become a Wellness Champion and the founder of Live Disease Free. And it's just awful to live with pain, chronic pain, unrelenting pain that doesn't go away, and the pain medications don't work very well. We're going to talk a little bit about the different types of pains, how we treat pain, and then we are going to look at the solution, how we can live pain-free. And yes, it is possible. There are lots of wellness champions that are doing this. So people have different tolerances to pain, that's true. But the type of pain we deal with multiple sclerosis or other chronic diseases is awful. And there could be acute pain or there can be chronic pain. One of the worst pains is trigeminal neuralgia, where we have this terrible, sharp, shooting pain in our jaw and in our face. It comes and goes. We can also have other types of acute pain that come and go with onsets of, let's say we're having an MS attack. So maybe you guys have felt that MS hug, where it feels like we're having this like blood pressure cuff on our torso and it's squeezing us. Or maybe that horrible electric shock when you bend your neck down. Let me know if you've experienced any of these things. So those are just a few different ones. And then spasms, right? The Charlie horses, where we wake up in the middle of the night and our calf can go, our arm could too, but it's very often our legs will have a really strong Charlie horse in the muscle of our calf. And those spasms can become so strong that they don't ever stop, and we can have this permanent spasticity and drop foot, and it's incredibly painful. So those are some of the more acute ones. And then with chronic disease, MS and other diseases, we can have this pain in our soft tissue, kind of like our skin feeling painful. And we can also have chronic issues of, if we're falling, we may have hurt our hips, our ankles, our knees. We might have concussion. So there can be muscular, skeletal pain from injury, from just living with multiple sclerosis. So that is another type of pain. So number one, we want to overcome multiple sclerosis. We want to overcome the pain. And that's what we're talking about today. The first thing that I want to share with you is just say hello. Hi, you guys. It's awesome that you're here. I'm so really stoked to share this with you because I'm really in this series of talking about the MS symptoms. I'm hoping that you see a pattern of the same cause. It is our immune system's response, that is the inflammation, to infection. And so in order to recover from pain, we have to treat the infection. So in science, they know that the innate immune response, so that's the first responders of our immune system. Those are the first parts of our soldiers and our defense system that rush in when tissue is injured. So when there's an invader that comes into our body, into our central nervous system, into our gut, wherever it is, then we have tissue damage. And with that tissue damage, there are these molecules or chemicals that are sent out, and they are called alarmins, like setting off an alarm. And they help to initiate this whole cascade. You may have heard of the cascade of cytokines. So those are other different types of molecules. So it's a very complicated orchestra of defense that we have. This signals this, and this signals this, and this signals this, and they all have very specific jobs. It's very complex. And so when we talk about autoimmune and we say, oh, our immune system has just gone haywire, it's attacking itself, I think that that is incredibly inaccurate, and it really does not follow our understanding of just how complex our immune system is. So again, we have this, something is damaging our tissue. It's usually microbes. It's usually some type of parasitic infection, and that causes the tissue to release these little molecules, these alarmins to sound the alarm, which also helps the expression and release of these cytokines, which are other molecules which will activate different parts of our immune system. And then with all of that being activated, then we have certain immune cells coming in to take care of the enemy. But we also have increased blood flow, and we also have increased sensitivity to pain. So all of this is happening. It's very well, like it's a well-oiled machine. It is so precise in how it works. And when I took cell biology many years ago, when I got my science degree, I had a really great professor, and he said, this is what we know at this time, and things are going to change. The body, the cell, the immune system is so complicated that we're learning so much, and there's still so much that we don't know. So that is why it is so important to understand that, you know, if we focus on suppressing our immune system, and that is what our standard of care does, then we will live with pain. We will live with the horrible adverse effects from the medications. We will lose our quality of life, and that is not the answer. So I'll keep it really simple. The biology part, I love the biology. I did a biology degree and math. But again, so there's tissue injury, then this sets off this whole orchestra of signals of different types of molecules that are signaling different types of cells to come in and get rid of the enemy, you know, start to heal, protect the tissue. It's all done automatically without us even knowing it. And so prostaglandins are one type of a molecule that is released by our immune system in response to infections. And I thought I would share this with you just because I talk about prostaglandins on my masterclass training. It is like the pain chemical. It's involved in, like a lot of times with women when we have PMS symptoms, pain, for example, when we have premature labor, or men and women when we have migraines, prostaglandins are involved a lot. So they are produced, prostaglandins are a pain chemical produced by our white blood cells, by our soldiers in response to infection. And research shows that MS patients have higher than normal prostaglandin levels as opposed to healthy people. And patients with active MS symptoms, so that they're going through a flare, they've showed sharp increases in the prostaglandin release, especially in the early stages of the flare, or even just before the onset of the flare of the MS attack. And then they drop off, but they still are higher than they'll still remain higher levels than healthy people. So that's just the prostaglandins, but again, there are all these other, the cytokines, the alarmins, and the immune cells that come in. So when we consider that, when we consider like, what is our immune system there for? What is it doing? It is protecting us from invaders. That is part of life. I talk about that on my masterclass training. From the moment we're born until the moment we die, there is a battle in our body. We are exposed to microbes through the air, through the water, through the food we eat. And we normally have this healthy defense system in our intestines. Well, I should backtrack. We have like in our stomach, if we have enough stomach acid, that will definitely take care of a lot of these pathogens, these disease-causing enemies. But then once the food, etc., enters in our intestines, we're supposed to have this thick amount, like an ecosystem, like a rainforest of healthy microbes that really make it hard for those disease-causing microbes to establish themselves. But because we've been on antibiotics in the past, maybe used certain medications, we've also had maybe too many grams of carbs, too much processed foods in our diet, too much sugars and breads and carbohydrates, which feed the problem. So we have a breakdown of our natural defense, and then we have a breakdown of our intestinal lining, and then we have these disease-causing microbes moving into our blood, into our organs, into our central nervous system. And when they get to the central nervous system, and even in the gut, this is where all of this happens, where the alarmins are set off, the cytokine storms happen, our immune cells are going in, they're bringing in extra blood into the area, and there's a higher sensitivity to pain. Different molecules like prostaglandins are released, and those are pain molecules. So we might take ibuprofen to try to block the pain. We might try Tylenol. I know with MS, they don't feel that those types of drugs work that well, so they use more antidepressants, things like that. But again, we still end up with living with pain. They might help a tiny bit. They might take a little bit of the edge off, but they have adverse effects, right? Some of the antidepressants cause us to be depressed. All of these Tylenol and ibuprofen, they all suppress our immune system. Again, and they're not touching the infections, but they're suppressing our immune system. So in time, I don't know if you guys have you heard about this, where you're on pain medication for a period of time, and then that pain medication actually causes you to have more pain. So that is a syndrome, and so it's extremely painful, and people have to come off the pain medication because the pain medication is actually exacerbating their pain. And I saw this on a documentary on television many, many years ago. So that's not the answer. We have to go back to the basics. We have to go back to common sense. What is our immune system doing? Whether it's our innate or adaptive immune system, it is defending us. What is it defending us from? Different types of microbes that should not be there, that are not health promoting microbes. Instead of trying to suppress that inflammatory response, instead of trying to suppress the war, let's target the enemy. Let's support our soldiers, let's support our body, and let's target the enemies. And that is the way to recover from pain. That is the only way to recover from pain. So that is common sense. That is the answer, and that is how the wellness champions are recovering. I'm just going to go to a couple of questions here, and then I'm going to share with you just the steps that we take. See if you guys have any questions, or maybe I'll just go through this and you guys can go ahead and type in any questions that you want. So the standard of care, it's fine for us to do massages, to do acupuncture, to do definitely whatever physical activity and stretching that helps. We don't want to, even with physiotherapy, if it hurts, I don't think it's a good thing to do. It's not going to, like, pain, when we're dealing with pain and causing more pain, that's not the answer. That's not what we need. We don't need to give ourselves more pain. But if you're doing some type of physio or some type of stretching or some type of exercise that really helps a little bit, manages it better, those are fine. They're not going to hurt you. There's biofeedback. There's, mindfulness. I kind of hate that because to me, it's an insult to people that have pain, because people that have pain, like, they're not willing this. Like, a lot of times it's like in your head, and I do understand that different people have different tolerances to pain, but you can't will pain away. You can try to take your mind off stressful things, and you can try to, put yourself into a more happy state. Those could possibly help a bit. But you just have to treat the infections that are causing the inflammation and the pain. That's really what it is. I mean, you can try cognitive behavioral therapy, mindfulness, and meditation, but really, in order to recover, you have to treat the cause. The cause are these infections that are causing tissue damage, that are causing inflammation, and pain is part of the inflammation process. So the nice thing is that'll stop when you have the tissue damage no longer happening because the infections are treated. Again, anti-seizure, antidepressants, that's what they're using for a lot of the pain meds for MS, and they have a lot of adverse effects on their own. And Tylenol and ibuprofen are not a long-term solution because they actually suppress our immune system, and that really benefits these infections in the long term. So what's the solution? That is the big thing. The wellness champions follow the Live Disease-Free system, and it's just basically simple steps that get you ready to treat, that get them ready to treat, and then they treat the infections. So the first step, the very, very first, most important step is stop feeding those infections. They thrive. The fungus, bacteria, different types of worms, single cell protists. Guess what their favorite food is? You guys know, type it in the question box. What is their favorite food? It is carbohydrates and simple sugars. So as you decrease the carbohydrates and simple sugars a lot, you will find that the inflammation starts to go down because those critters are not as active. They're not producing as much poison. Our immune system doesn't have to work as hard. Inflammation starts to go down and pain becomes less. First step, very, very important. Then we have to support the body. So this is where we make sure we're sleeping at least 8 hours a night. And yes, if we're in pain, sometimes we have to use sleep aids. But again, with the eating plan, that is one simple, healthy way, the Live Disease-Free diet. I've got videos on that on YouTube and Facebook. Make sure to go and watch them later so you can watch those and you'll learn about the Live Disease-Free diet, the guidelines. So the key is to start the inflammation to become less through that, then supporting the body by sleeping enough, so having at least 8 hours of sleep, having daily bowel movements, looking at our blood work, supporting our physiology, cleaning up our environment, all of these different things, then that is helping us to feel better again. So the inflammation is going down a little bit more. Then we start to look at what kind of infections do we have. If we're diagnosed with something like multiple sclerosis, PLS, Parkinson's, MS, what I see in my students is we usually have fungal overgrowth. We have a history of fungal overgrowth. We have a history of different types of parasites. And they're all parasites, but I'm talking about worms and single cell parasites. And we also have a lot of symptoms, very often, most often, of the Lyme disease infections. And so from there, then we make a game plan and we start treating. We start with the biggest problem, which are the biggest offenders, the biggest worms, etc. We treat them for 14 days. Then we treat fungus for about 10 days. Then we take a break. And on the break week, then we're just using herbs. We're kind of treating, it still will treat fungus a bit, but also the Lyme infections and different types of bad bacteria. And that's one cycle. It's about a month, a 4 to 5 weeks type thing. And if we have completed a successful prep phase in the Live Disease-Free system, meaning the diet, the Live Disease-Free diet and supporting the body, then the treatment part goes a lot better. It works a lot better. So that means that the parasite drugs, the fungal drugs, the herbs, the oxidizing agents that we're layering on these different treatments, they work a lot better. If somebody has not been diagnosed yet, but they really suspect they have something like MS or another neurological disease, or maybe they've had it for just a few years, but they're still functioning really well. They can still work. They're suffering, but they're not fully disabled. It might take them 3 to 4 months before they become symptom free of going through the system and maybe 1 or 2 treatment cycles. If they've been really disabled for years, it might take 10 or 12. Everyone is different. There is no rhyme or reason to this other than the better implementers are the ones that get the success more quickly. So I know that people that have chronic disease, they have these addictions to these carbs that are, I would say, like drug addictions. They have such a hard time giving up different types of carbs. It's because these infections make you crave these carbs like a drug addiction. And so little tiny cheats will make it so people don't move forward like they should. But people that get the carbs low enough, they have miraculous improvements more quickly. They get on with their life more quickly. Their pain subsides. The spasms, those horrible spasms, the spasticity, the drop foot resolves. People actually no longer use walkers. They can come out of scooters and wheelchairs. I can never promise because it's up to them. But the exciting thing is that we are seeing that people can have more recovery than they thought possible. And as we go along in time, we are going to find better and better ways to help them to treat more effectively. So those are the steps that we use. And the students will do several cycles, and they'll usually treat until they have been symptom free for at least a couple, 3 months, because there are eggs, there's immature forms, there's larvae, there's also biofilms. So we have to address all of these things to work the level of infection, these parasites, down low enough so that the pain, the inflammation, all the other symptoms are gone. So that is really the only way to recover. And it doesn't matter if we have arthritis or if we have epilepsy or if we have inflammatory bowel disease or MS or cancer. They're all caused by different types of infections that like to live in different parts of the body. And it doesn't matter. So if the pain is caused through arthritis or if it's caused with MS or if it's caused with PLS or whatever, it's all, if we stop thinking about individual diseases and we just think about the immune system, how it works, how it deals with infection, and the differences would be that, some of these critters like to live in our joints and cause joint pain and give us arthritis. Some of them like to live in our reproductive organs. Some of them like to move into the central nervous system and some in our brain and cause migraines. So it really depends on which microbes, which parasites we have, where they're located. But the immune response is very, very similar. It's going to take care of different parts of the body that become infected, that are in trouble. And we're very fortunate to have this. So we need to protect our immune system. Do I believe that our immune system is just attacking itself? No, I don't. Why? Because when the wellness champions treat the infections, their immune system no longer attacks their tissue, their myelin, whatever tissue it is. So that is, I believe that whole scientific theory is a decoy so that we don't treat infections, so that we just suppress our immune system. So we live with our disease, we live with our pain, and we live with the inflammation for the rest of our life. And we really compromise our quality of life. We lose our life. We become disabled completely. And so I think there was a decision made a long time ago. Let's not treat infections, but let's put people on maintenance immunosuppressive drugs for the rest of their life. That way we have a customer for life. And I'm not saying that our doctors have done this intentionally. Absolutely not. They have been trained that this is the only way we do things. They have the answer. There's no known cause. There's no known cure. The immune system is attacked. That's what they're trained. And if that's what you're trained, then that's what you do because you trust and you believe that, well, why would they tell me a lie? So the exciting thing is I want you to know that if you decide to take a different path, that there is hope for you, but you can't keep suppressing your immune system. You have to treat the cause. You have to treat the infections that are causing the pain. That's the only way to recover. Yes, if you've had injury, that's different. That's a different kind of pain, right? But when you support your body with all these steps, it can heal to its best ability, and very often that pain can still be resolved. So I'm going to go to a few questions here. So with our students, we have had let me just close this here. We've had students where the trigeminal neuralgia becomes resolved. And again, the muscle spasms are resolved, the spasticity, the drop foot can resolve, migraines resolve, that achy, tender pain right underneath your skin all over your body resolves, neuropathy, the numbness, the tingling, the muscle weakness, pains in hand and feet resolves, and no more burning or stabbing pains. But again, it is treating the cause, treating the infections that are triggering the inflammation, so your immune system is no longer fighting. All right, so let's see here. Hi, Sharonda. Good to see you too. Hi, Maurice. Hello. Hi, Aurora. You guys have any questions for me? Alexander, Sherry, you get spasms at night. You get up and you try to walk them out. You have had drop foot. So the parasites are very active at night. They really are. Some of you may know that late 3 o'clock-ish where you wake up and it's kind of like the witching hour for the parasites. Very, very common. So if you treat the infections, those spasms will go away. Hi, Debbie. Good to see you. Hi, Bonnie. You used to get like spasms really bad at night time and early in the morning. Yay. So Debbie is a wellness champion, and she just shared there. She was one that had leg spasms and they were horrible. They're absolutely, it's just like a permanent Charlie horse. It's brutal. And she doesn't have them anymore. Thanks for sharing, Debbie. That's awesome. Aurora, hello. Hi, Susan. Let's see here. Absolutely treat the infections to get your life back. Aurora is another wellness champion. And Debbie, sugar, carbs. Yes, you guys are right. Carbs and sugar feed that's their favorite food. That's why we crave them. So it's not just that we have sugar addictions, but those parasites make us crave carbohydrates and sugars like a drug. Catherine, even getting carbs down to 50 has made a world of difference in your life. I'm so happy to hear that. If you go a little lower, it'll even make more. We find that the sweet spot is about 30 to 35. We say 35 to 40, but some students find 30 is even better. Hi, Suzanne. Pam, your quality of life has left you after 42 years of having MS. You're at your wit's end right now. Night, you lay down to go to sleep. In the morning, you wake up and you realize that you're having bladder issues. So my heart goes out to you, Suzanne. It's brutal, and I am so sorry that you're going through that. That's why I do the work that I do. So there are 2 reasons why you're having bladder issues. That's very common with MS. Basically, all people that have multiple sclerosis or patients that have MS eventually have horrible bladder issues. They get regular urinary tract infections. They get up multiple times throughout the night. And if you don't do something different, it's just going to get worse and worse and worse. We get to the place with MS where we literally become trapped in our body. And the last stages where we can't even breathe. It's brutal. Like we lose all function of our nerves. This is all caused by infection. When you follow, like even Suzanne, even if you start by learning the Live Disease-Free diet with what I have online, with YouTube, go to Live Disease-Free YouTube. There's a playlist about the diet, and start to implement the diet. Your bladder will have a huge improvement just with the diet alone. That's only if you get the carbs low enough. If you get them down to, again, 35 to 40, under 50 for sure, but you'll see a more improvement between 35 to 40 total grams of carbs. That means sugar, fiber, carbohydrates, starches. You add up all of that. The total in the day should be, with everything you put in your mouth, it should be between 35 to 40. And you will notice within a few days that your bladder will start to improve. It's not going to get rid of the infection, but it's going to start to give you some relief to show you that this does work. And then after that, then continue to follow the rest of the steps. Good for you, Catherine. No sugar, no gluten, no dairy. And so sugar, like we have to be careful because sugar can come from fruit. We're in the beautiful Okanagan where we have peaches and cherries and apricots and plums, and we're going into that prime time. And those infections will feed off of fruit sugar, honey, agave syrup, all of those things, maple syrup. So we can't just avoid like sucrose, sugar, but we have to make sure we avoid all sweeteners because they will all feed the infections. How do I find out if I have parasites, worms? Sherry's wondering. We don't have good tests. So you could go and this is something that we're working on. I'm working with the MSIDI, the Multiple Sclerosis Initiative, Infectious Disease Initiative. And it is a lot to put into place. Like it is taking time, unfortunately, because we want to do clinical trials. We have to get so many things lined up, going in a different direction from our standard of care of MS. But the key is that we don't have good tests right now. So you could, if you have, let's say with your doctor, you could do a stool test, a parasite test. Go ahead. If it doesn't cost you anything, you can do it. But you'll probably find that nothing shows up. Or there might be a small single cell parasite that shows up and they might want to put you on antibiotics, and it might make you feel even worse because that small blastocystis hominis or a type of entamoeba is probably not causing your major symptoms. So instead, what we do, like there are also DNA tests, but again, they're not good enough yet. And then there are, let's see, DNA, I think that's about it. So I just say save your money, right? And don't bother with that. So what our students will do is they'll first go through the prep phase. They'll stop feeding the infections. They'll support the body. Then they will get samples of common parasite herbs and drugs, and then through practitioner, and then they will be energy tested. And energy testing means that they'll take one sample of a parasite drug, they'll hold it in your energy field, or they'll put it on a little plate, and they'll see, does this make you stronger or is there no difference? And they'll say, okay, yes, this one, no, that, not that one. So instead of trying to figure out which parasites you have, it's figuring out which remedies test the best for whatever parasites you have. And we found that to be the most helpful. And so then from there, the students will get a prescription for those parasite drugs. And that's what we help people to do in the Live Disease Free Academy. So what I recommend is that if this is the first time that you've met me, and this sounds really interesting, but you're just like, I'm not sure, watch my videos on YouTube, and especially on YouTube. Subscribe there, and you'll be notified when I go live. Look at the playlist of the infections, of the successes. I'm going to be uploading a few more in the next couple of days here. And the diet, and just start to change the diet, start to experience symptom improvement, learn about the infections. When you're at the place where you're like, okay, I'm having a hard time finding somebody to help me to treat these parasites. Unfortunately, that is the case right now. We're working hard to change that, but it's a lost skill. It should not be a lost skill, but it is a lost skill. And if you need support, then make sure to watch my masterclass training, how I and the wellness champions have recovered from MS. And then you can book a time with me. You can become a wellness champion. You can join us in our class. We have students from all over the world that are recovering right now from not just multiple sclerosis, but other chronic diseases. And we've been doing this for years. So we have a lot of skills. So it doesn't really matter what country you live in. We're in 15 countries. I will help you to build a plan and to access the treatments and to find practitioners you need, etc. Because that is the hard part at this time, is finding somebody to help you. And I wish it wasn't the case, but it is. It's just ridiculous. And I'm hoping that in time I can work myself out of a job. That's my goal. Hi, Francis. Where can I see the list of what I should and should not eat? So on Facebook, we have a Live Disease Free community. Live Disease Free community. You just have to do a request to be joining it. And there, I think under files, there will be the cheat sheet. And I'm not sure where, like I've also put together a little video. I was going to put it on our website. That's another to-do list. We just created a short video on the guidelines. So there's a little PDF 2-pager with the guidelines, and then a 3-minute video that I will be putting on the Live Disease Free page also. If you become part of the Live Disease Free community, you'll see it there. And just if you watch my masterclass training, you can opt in with your email address and you'll be on our list, and you'll be notified when I do live trainings also, and when we are, releasing different things like the video for the eating plan. The diet is very powerful. It is so incredibly powerful. Like I just think of Belinda, one of our newer students, just treating. I think she's on her 2nd treatment cycle, but with the diet, all pretty much like the vast majority of her spasms and her neuropathy were gone. Not everyone's like that. Again, everyone implements differently. But if you really focus, like I'm going to get the carbs low enough, you'll be shocked at how much symptom improvement you'll have, because those critters don't like that. They want food. But that's the reason. It's not that I've created this ingenious thing. It's just that we know what's causing the problem, and we know how to make them suffer a little bit. Hello, Daryl. Is there harmful sugar in berries? So sugar is not harmful. It's just that the sugar in any type of fruit will feed the infection. So if we eat too much fruit, like even berries, even a green apple, like I would stick with a half a green apple or a 1/4 cup of berries, if that even. This is where you can play around. You can just take fruit totally out. You can take nuts totally out. You can get the carbs low enough. There's still lots of good food you can eat. It's very nutritious. It's very tasty. And you'll just and then tell me, like, I really appreciate when you guys tell me that how much it's helping you, because that is why I do this, right? I'm doing this for free. I'm giving you my time because I want you to be well. Hi, Maina. You know a doctor that can help you get rid of permanently? Okay, I don't know. Awesome. So the thing is that, Maina, I don't know which doctor, but I guess what I'll do for just a minute here is just to kind of help people to understand that there are a lot of doctors that will treat candida, and integrative practitioners, I should say, not really doctors. So in Canada, it's for sure not, but in the US, it's hard to find. So they'll treat candida, they'll treat Lyme, but there's only just a small handful of doctors that we have found that are skilled at treating parasites really well. And if you don't do these other steps, the parasite treatments don't work very well. So yes, Maureen, you're saying that you've experienced all types of pains that I mentioned, and you're definitely been infected, and you have been a carb and sugar addict. It's true. And thank goodness you don't smoke or drink. That's awesome. Hi, Tina. Good to see you. Hi, Robin. Hi, Robin. Thank you so much for the love. Really appreciate it. Hi, Debbie. So I'll just go for a couple more minutes here. People out there, oh, thank you so much for your kind words. And Victoria, so Debbie's had a lot of success in following this Live Disease-Free system. And Victoria, your parasite test came back negative. There is no doctor who can help with parasite treatment, no help here in Boston, and that is the problem. The parasite like even if you get these DNA tests, they're not showing up. And what's in the stool, like whatever's in your blood and in your organs and in your central nervous system are not going to show up in your stool either. So that is the problem with the stool tests. That's why I say save your money. Don't spend your money on comprehensive stool analysis or DNA testing. We are going to start looking at, like with the M-City, we're going to start looking at like blood, like maybe metabolites from certain types of critters, but we're looking for parasites that we see are quite commonly involved. So filarial worms, you'll see on YouTube, Live Disease Free, the infection playlist. I talk about these small filarial worms, tapeworms, roundworms, certain things like babesia, which is one of the Lyme infections, and Borrelia, for sure, Candida, absolutely, but also things like Aspergillus. So we would like to find ways to directly or indirectly test for some of the parasites that we know are common in chronic disease that are not showing up on these tests. Robin, awesome. You are so very welcome. Thank you for your kind words. It does make sense. It is. We have to go back to common sense. Please don't feel like I'm not a doctor. I don't know. I wouldn't be able to know these things because I'm not a doctor. Go back to common sense. You do know when things make sense to you, follow your gut for sure. Victoria, what do you think about those meds for parasites available online based on essential oils? I love essential oils. I really do. But we have found that maybe if, let's say, if you're super healthy, you have no neurological symptoms, maybe you've just been on antibiotics and maybe your gut is off a little bit, maybe you have a little bit of gas or constipation, then you can try the different types of wormwood and black walnut and cloves and those types of parasite drugs. Those would be for some of the bigger parasites. And then there's all kinds of other antimicrobials. There's olive leaf extract, there's grapefruit seed extract, there's garlic is really awesome. There's oil of oregano. And yes, our students have passed worms with taking those, but they have not been able to recover from MS. So this would treat more of the intestines, but not necessarily deeper into the body. And also, our students are passing sometimes up to 2-foot roundworms. So the herbs will not be strong enough for those either. And so what we're using the parasite drugs, but they have to use a safe and effective dose with herbs and with oxygen type therapy. So they're doing enemas where they're directly hitting the parasites in the intestines, in the large intestines, and then they can take the oxidizing agent orally, which will also target different types of infections in the blood. It does not interact negatively with the different types of medications and herbs. So, but we do things very systematically. We do things like one at a time, and we first make sure the student is prepared well so that they handle the treatments better and that the treatments work better for them. So that saves them time and money. And then with that, it's very important to, bring things in as the student is handling them. So we've had to be really involved with the doctors, with the naturopaths, with the pharmacies, because it's something that is just not well understood. So we have doctors that are learning from our students. And so if you're at the place where you're like, well, I've been looking and I can't find someone and I don't want to just wait, reach out to us. Watch my masterclass training. If you're ready for the academy, book a time to chat with me, get your questions answered, and you can start this journey right away. It is life-changing. The neat thing is it's not just for MS. So like your whole family or your household, it applies to everyone. We're all out of balance. It's just that some of us are out of balance a lot more than others. And so as we decrease these infections, the pain goes away, the other symptoms go away, and then we do treat parasites at least once or twice a year for prevention in the future to make sure we never end up in this position again. That would be our partners, our spouses, our children. And then we can prevent chronic disease. And then we can add many, many quality years to our life. Okay, a couple more questions. There's a lot of questions. I love chatting with you. Barry, you've eaten many rounds. You've had several rounds of parasite meds and fungal meds, obviously because the carbs and sugars are not low enough. No, Barry, to be really honest with the parasite drugs, with our students, they usually test well for 3 to 5 parasite drugs. So they're using a specific dose. They're combining them in a safe way that they're We know that they're tolerating it, so we want to avoid Herxheimer reactions. So it has to do with the dose you're taking, which I don't know what doses you're taking. It has to do with, are you, did you test well? Usually people test well for more than one, so it's usually 3 to 5. And when you're doing multiple together, there's more of a synergistic effect. But then we also found that even myself, I've done like 5 parasite drugs together for a whole week. I don't have MS, but I'm doing prevention, right? And I never treated worms well enough and parasites well enough. And sure, I passed a couple of roundworms. I didn't really inspect. I saw them in my stool. But it wasn't until that after a week of doing all 5 parasite drugs at the dose that was recommended, safe and effective, then I started doing the enemas, and that's when I started to pass the worms. So the drugs by themselves were not strong enough to clear the parasites, and that was taking 5 together at a time. So this is the experience that we have, is that your greatest success, yes, absolutely, the prep phase has to be in place. But then it's not just that, and maybe in time, more doctors will get involved and they can work me out. That's absolutely what I would love. And maybe it'll be that they're doing higher doses, and maybe they'll be doing for longer periods of time. So, but at this point in time, these are the recommended doses that we're using that are safe, and they're not enough. By the time this drug gets all the way down to the bottom of your large intestine, it's not enough to kill the parasite if they're bigger parasites. So, like, some of us can have tapeworms that are many feet long and roundworms that are really large. And so that's what and then we have to know that the drugs treat different types or different parts of the life cycle. So some will kill the adults, some will kill the larvae, some will kill the eggs, and some will cross the blood-brain barrier and some won't. And so that's what we do in the Live Disease-Free Academy in our system, is really factoring in all those things. So we find layering the therapies are a lot more helpful. And I would not recommend to continue to take parasite treatments, because you can make the bugs resistant to them, to the treatments, and you don't want to do that. So that's where the students will have to back up, and they will make sure they're following the prep phase. And that's what I help them through the academy, is troubleshooting, right? Figuring out where they need to implement better. Aurora, thank you so much for your kind words. Francis, you're part of the group. Yay. Oh, thanks. I'm part of the group. I'll take a look. And then Robin, cool. Part of the Facebook group. Okay, you guys are part of the Facebook group. Great. And I'm so grateful that you're here, Robin, because I just wish we could get this word out quicker. Please help share this video. Help me to get the word out about infections. Start talking in different groups about infections. I love Dr. Terry Walls. I'm so grateful that she had so much symptom improvement with what she did. Her diet is great. It's not strict enough. It's still too many grams of carbs, but she really doesn't understand the infection part. And so she still deals with pain. She still has to take medication sometimes. I don't take medication pain. I don't take any type of pain. I don't need to take pain, because I've treated the infections well enough. I'm not a superstar. I just really get it, and I've really been diligent, and it is by the grace of God. I have asked for a lot of help from him for sure. But there's just so many people that could be helped. We have to bring an end to this misery. There's no point in it, right? We don't need to live like this. So I'm going to let you guys go. There's a lot more questions. I love you guys. I really do. I'm going to be back next Wednesday. Just keep joining. Make sure to subscribe on YouTube, Live Disease Free. Check out this playlist there and start to change your diet. Get the cheat sheet. Tell me how much it's improved, how much you've improved. And then when you're ready, if you need support, make sure to reach out to me, watch the masterclass training, and you can become a wellness champion. So with that, I'll let you go. Take care and bye-bye for now.